Removal of foreign bodies in the upper gastrointestinal tract in adults. European Society of Gastrointestinal Endoscopy, ESGE, Clinical Guideline. Introduction. Foreign body ingestion and food bolus impaction are encountered commonly in clinical practice. The majority of foreign body ingestions occur in the pediatric population. Most ingested foreign bodies, 80% to 90%, pass spontaneously. However, approximately 10% to 20% of cases of foreign body ingestion require endoscopic removal, while less than 1% will need surgery for foreign body extraction or to treat complications. This guideline is an official statement of the European Society of Gastrointestinal Endoscopy, ESGE. It addresses the removal of foreign bodies in the upper gastrointestinal tract in adults and aims to provide endoscopists with a comprehensive review of diagnostic and therapeutic treatment options for swallowed foreign bodies in adults. For the management of ingested foreign bodies in children, the authors refer to the clinical report of the NASP-GHAN Endoscopy Committee. Recommendations. Non-endoscopic measures. 1. ESGE recommends diagnostic evaluation based on the patient's history and symptoms. ESGE recommends a physical examination focused on the patient's general condition and to assess signs of any complications. Strong recommendation, low-quality evidence. 2. ESGE does not recommend radiological evaluation for patients with non-bony food bolus impaction without complications. Birk et al. Recommend plain radiography to assess the presence, location, size, configuration, and number of ingested foreign bodies if ingestion of radiopaque objects is suspected or type of object is unknown. Strong recommendation, low-quality evidence. 3. ESGE recommends computed tomography, CT scan, in all patients with suspected perforation or other complication that may require surgery. Strong recommendation, low-quality evidence. 4. ESGE does not recommend barium swallow because of the risk of aspiration and worsening of the endoscopic visualization. Strong recommendation, low-quality evidence. 5. ESGE recommends clinical observation without the need for endoscopic removal for management of asymptomatic patients with ingestion of blunt and small objects, except batteries and magnets. If feasible, outpatient management is appropriate. Strong recommendation, low-quality evidence. 6. ESGE recommends close observation in asymptomatic individuals who have concealed packets of drugs by swallowing, body packing. The authors recommend against endoscopic retrieval. They recommend surgical referral in case of suspected packet rupture, failure of packets to progress, or intestinal obstruction. Strong recommendation, low-quality evidence. Endoscopic measures. 7. ESGE recommends emergent, preferably within 2 hours, but at the latest within 6 hours, therapeutic esophago-gastroduodenoscopy for foreign bodies inducing complete esophageal obstruction and for sharp-pointed objects or batteries in the esophagus. Birk et al. Recommend urgent, within 24 hours, therapeutic esophago-gastroduodenoscopy for other esophageal foreign bodies without complete obstruction. Strong recommendation, low-quality evidence. 8. ESGE suggests treatment of food bolus impaction in the esophagus by gently pushing the bolus into the stomach. If this procedure is not successful, retrieval should be considered. Weak recommendation, low-quality evidence. The effectiveness of medical treatment of esophageal food bolus impaction is debated. It is therefore recommended that medical treatment should not delay endoscopy. Strong recommendation, low-quality evidence. 9. In cases of food bolus impaction, ESGE recommends a diagnostic workup for potential underlying disease, including histological evaluation, in addition to therapeutic endoscopy. Strong recommendation, low-quality evidence. 10. ESGE recommends urgent, within 24 hours, therapeutic esophago-gastroduodenoscopy for foreign bodies in the stomach, such as sharp-pointed objects, magnets, batteries, and large or long objects. The authors suggest non-urgent, within 72 hours, therapeutic esophago-gastroduodenoscopy for medium-sized blunt foreign bodies in the stomach. Strong recommendation, low-quality evidence. 11. ESGE recommends the use of a protective device in order to avoid esophagogastric pharyngeal damage and aspiration during endoscopic extraction of sharp-pointed foreign bodies. Endotracheal intubation should be considered in the case of high risk of aspiration. Strong recommendation, low-quality evidence. 12. ESGE suggests the use of suitable extraction devices according to the type and location of the ingested foreign body. Weak recommendation, low-quality evidence. 13. After successful and uncomplicated endoscopic removal of ingested foreign bodies, ESGE suggests that the patient may be discharged. If foreign bodies are not or cannot be removed, a case-by-case approach, depending on the size and type of the foreign body, is suggested. Weak recommendation, low-quality evidence.